of the things that I'm really into talking about with a lot of people is the perceived differences that we have in this country between what is the way certain areas are actually run and how people perceive that it is that they're run. Here joining me today is Dr. Antonio and Mr. Antonio. I've known Antonio from a long time ago, many years, just about 7 years ago from when I studied in Germany, and he's currently a physician in Spain and is here doing a rotation to better gain some more experience and basically get a look into our system and the way that we run things over here. Antonio is also an engineer who specializes in the administration aspect of healthcare. Both are, young and early in their field, but these guys are definitely going to be leaders of tomorrow in their areas, and so I'm very grateful to have them come on the show with us and talk to us a little bit about that. So, Antonio, why don't you tell us a little bit about just the initial differences that you see?
Basically, I can't say much here because the system here is completely different I mean in Spain, because in Europe there are many differences as well, but basically here in Spain is everything the insurance. You need to get an insurance.
It has to be insured.
Yeah, and you rely on them on whatever happens to you. In Spain, it's totally different. From the beginning, the government takes care of you. We call it social security, and your taxes mainly go to that. It's a kind of insurance, but provided by the government. So the main difference is that, but everyone pays the same, more or less pays the same percentage of the salary. Anyone gets the same treatment, or here is completely different because you get different, you know better, different insurance, really expensive, and I couldn't say more here, so maybe I'll let you do it.
The common concern is that the healthcare is made available to everyone, but it's due to an absurdly high tax bracket. How true is that? Does that tax really hurt the lifestyle that most Europeans have?
I can say only in Spain. I don't think it's such a big amount.
So it's not a burden. It's not something
no,
that you
because we're working in that field. You don't know how expensive is everything. So when you really need something in Spain, you get ill because of something, and you need expensive treatment or something, you get it, and there's no worry. Because maybe oncology is the thing that people is more worried about. The cancers.
This is what happens when you're live from New York!
I got a little attention. Y'all don't know what's happening behind the camera, but Jalen is too cool. You're just like, no, is it cool? My office. And they were like, all right. All right, so you guys have payroll taxes, and how much does that take out? And also income tax, how much does that take out? That's a good question.
Like, get any idea about that? No, I can say.
Yeah, I mean, like, all right, for you, like, how much should you pay in taxes? Like, do you have tax returns? Like, oh, it's tax season, I gotta hand in my tax stuff, and then I pay money, or is it not like that?
I don't know. I get my salary, and taxes get, I don't know, maybe 23%.
That's it?
Yeah.
That's 23%.
Yeah. So you're saying 23%?
But I'm not sure, but around that.
Around the ballpark.
Okay. All the percentage that came from your salary is not dedicated to the national insurance. It's also for when you are unemployed, you get like a payment until you get the next job.
Yeah.
Okay. So it's divided. So also I think it's not such an amount quantity. Yeah. It's 23%. It depends on your salary, and yearly you have to do your taxes declaration, and also if you have low income, they can give you more money.
Yeah.
Okay, and if you have high income, probably you will have to pay more.
So it's a similar tax system too. Like, that's what I was wondering, is like, or is it a different taxing, or is it flat tax, which is like, you see like a lot of GOP elected officials, including Trump, wanted that flat tax plan or whatever. But so it's generally a very similar system, and yet you guys were able to still afford universal health care.
But the problem with the healthcare in Spain, it was completely free for everybody. independently the country where you came from, it was free. If you went to Spain a couple years ago, you get sanitation for free. So, but it wasn't so good for us in Spain because a lot of money was spent on patients who didn't pay their treatment. So.
People took advantage of it.
Yeah. People came like from England to take their surgery in Spain and then go back to England.
Because this is still when the pre-Brexit basically.
England, France, Germany, doesn't matter.
Yeah.
So a couple years ago, this stuff changed. Now if you are not national insurance, you have to pay for your attention, and I think it's normal. It's normal because it cannot be free for everybody.
Yeah.
But probably there should be some exceptions to people who cannot afford that because there are a lot of immigration and people who really cannot afford a surgery emergency.
Yeah.
At least.
That's wow. That is light years ahead. In my opinion, I thought that's light years ahead of where we are in the United States. I thought you were going to say something about like scaling back the insurance for citizens themselves, but this is still like it's not even a consideration. It's like, all right, well, if you're not from the country, then maybe we have to find a way for you to pay. So if you become a citizen or anything like that, then you're starting to pay, so you receive the healthcare. So really, it's just like if you're part of that, then you receive universal healthcare. That's very different than the United States. I don't even know what health insurance covers for people who are immigrants in the United States. If you're a green card holder or if you're like waiting for a green card holder, I think it's just like none.
You need to have your private insurance.
Yeah, which is crazy. I mean that's I think. I don't know, the plan that you're talking about is fair, whereas like, all right, just become a citizen so you can pay some taxes. That's all we need. Just, everyone puts just it.
I think it's fair to say that, or at least in my opinion, I think it's fair to say that this comes from from an understanding of two very different perspectives on healthcare and the fact that healthcare as a privilege as opposed to healthcare as a right.
Yes.
I think that it's important to note that because we hear some proponents of the healthcare system here it will say, okay, well, a socialized system will keep people from getting better healthcare, from access to better healthcare.
I think the main difference also is when you focus on the money or in people, in the health of people.
Okay.
And here I think it's more focused on money. Healthcare.
Very much so.
Can you tell us a little bit about, because you have experience in the administrative side of it, can you tell us a little bit about maybe some of the differences or maybe not differences, but tell us a little bit about how things run in Spain so that people that know about healthcare here can compare?
The problem is that I really don't have so much information for your healthcare system here. I know that you.
Well, just about that's okay. Just about Spain, like how. Just give us a little bit about how Spain runs, because people here are under the impression that socialized or universal healthcare is logistically unachievable.
Mainly the hospitals in Spain are public hospitals. We also have private hospitals, but public hospital is ruled with governance money. So and also public, also everything. The management of the hospital is public, so it's not like they're not looking for a profit with the management of the hospital. They're trying to change that also. They're trying to make more privacy management for the public hospitals.
They're trying to privatize.
Yeah.
Okay. That's dangerous by itself.
And I think that it will be something similar like you have here.
That would destroy.
That would destroy the system over there.
That would destroy the system over there. I mean, even if we were to have the way that we have the Obamacare set up is that the government is just paying the insurance company, right? And so there's still this idea of money that's still a motivation behind it. What the effect of that is that you have now a lot of things where you can have preventative treatment. However, that's cheaper, and the hospital receives less of the insurance payments if they're to do preventative treatment, right? So, they might come in, the guy feels pain or anything else on the side, and the doctor may be more inclined to give him prescriptions for painkillers as opposed to doing diagnostic checks, right now, and he finds out that he has Crohn's disease, right? That's going to cost him a lot more and the hospital a lot more money. And that happens very much repeatedly, especially before Obamacare. That was a big way of driving a lot of people into debt. So yeah, I think as a society, you know, the way that I take it is that there's some things that should not have money as the main motivation in progress, right? Education is one, healthcare is another.
Yeah.
The prison system, prison industrial complex. I don't think there should be money as a motivation in terms of whether or not we put so many people behind bars, which is one of the reasons why we have the largest prison population per capita, more than North Korea, who actually has, right? Generational prison system, right? So like my mom was in prison, now I'm in prison, like they have that, you know? And
Their
we still,
heritage.
right? And we still beat them, we still have more prisoners per capita, not like overall, just like per capita, which is crazy. You know, that brings in light a lot of different issues that I think we're still facing today in this country.
I'd like to ask Antonio one question. So, Antonio is a physician in Spain, and one of the things that sometimes people talk about having this universal healthcare is the fact that there's also going to be a difference in what the doctors are paid, right?
Absolutely.
And so one of the things that
Black Harvest, yes.
Live from New York. That's what happened.
I gotta know. It's like a roller coaster. Oh yeah, perfect. That's
Hey,
great.
party people.
Right?
That's Fifth Avenue, man. That's Fifth Avenue.
Oh, for those of you who are just tuning in right now, we are here in front of the public library, New York Public Library on 45th. That's a lot.
Beautiful, yeah.
Yes, 42nd. 42nd and 5th Avenue. So if you're around the area, come by and say hi. That'll be hilarious. Like, seriously. Like, I'll do the happy dance for you. Don't worry. Oh, yeah.
So as I was saying, so one of the key differences is payment, right? And so Paul's question about the differences in compensation got me to think about that. So why don't you give us just a ballpark? You don't have to disclose any personal information, but just the ballpark of what a physician, like in their first couple of years before, right after specialty, makes in the ballpark.
Okay, take this. 90% of the sanity in Spain is public. Only 10%. Yeah, only 10% is
Private.
It's private. So the point is, the public system don't pay you much. Don't pay you much. So if you compare it with here, it's unbelievable the difference here. So maybe one doctor from my age might be getting 4 times my salary. What's that? What does it bring? Many people try to come here or try to go to another countries because Spain is a little bit different in this case as well. So many doctors try to go to Northern Europe because they are getting better play there. So
And also in Spain, they keep both works, private and public.
yeah, people try to get more money by switching the.
Do they work for both at the same time?
Yeah.
So you're saying that you could be a doctor at like you could have a shift in the hospital, and you could also have a shift at a private clinic.
Yeah, absolutely.
Okay.
Yeah.
All right. Gotcha. But they make it work. Is that? Are you're saying that?
Yeah, but the point is, best doctors normally work for the public system.
But the best doctors work for the public.
Yeah,
Okay.
because most
That's
of them
fascinating and
aren't
interesting.
the best.
Okay.
Normally do that.
Okay.
What do they do? If they want to get more money or want to work more, they are able to go outside and
That's amazing.
work privately.
Okay, so see that's interesting, which and it also reflects a difference because here you want to basically you want to go through the public system.
Yeah.
You want to those are the trenches for you,
Yeah.
and you want to get through it, and then and really because that's right. You want to get through it and set up your own practice and make the big bucks.
Yep.
So it's interesting how just this is just to compare the differences in the system.
I put you an example. Which doctor do you prefer to make you a liver transplant? One that has made 50 in 6 months, or one that has made 2 in 1 year?
Yeah.
So In the public system, they make it every day.
Yeah, it's
in-
clockwork.
Yeah.
In the private one, it's almost impossible to get
That's
one.
brilliant, and that's why it's like some of the best doctors are in the public.
That's
like
it.
most of the best doctors are there because
That's
they
it.
get most of the practice. I love that.
I love it.
Wow. And
So-
just small side comment was that it's right. It'll be the exact opposite in the States. It's one of those things where it's like the best, then you have to pay the money for it, that type of thing. I'm very like, you know, like, you gotta pay the money. Give me the, you know, like the. All right, so me and my girlfriend do this weird, like it's called like the loot face, which is just like.
That's the money face.
There you go. Shouts to Mary if you're watching that. All right, go ahead.
No, good. I mean, I think is there anything else? I mean, anything else? I mean, I think that was just kind of. Do you have any other questions?
I mean, can we talk about the movie we shot last night?
All right, a quick mention.
Yes.
Quick mention.
Yes.
You gotta-
All right. Okay. All right. So last night we shot, and all right. What's Mark's last name? It's like Mark.
Fraunhofer.
What was it?
Fraunhofer.
Fraunhofer.
Alan Holfa.
Fraunhofer. All right. So Mark Fraunhofer. He sounds very French though, which is hilarious.
He might have been French. I don't know.
Yeah, right. Right. This is what we're a cosmopolitan world, so you know. But Mark Fraunhofer. Terrible. I shouldn't do that. But he called me Friday night, and he was like, "Yo, I ran out this restaurant, and I need a script and a director and actors. Can you do it?" And I was like, I honestly, like, real talk, I was like, haha, it's a phone call. Oh, wait. And like literally, but he called the next day, and I was like, oh shit, he's for real. So in like, I guess that's 3 days, right? We were shooting on Monday, all right? Monday fucking night, or whatever. It was originally gonna be from 11 to midnight. I was like, I can't do that.
And on
'Cause
President's Day.
Yeah, President's Day. On President's Day, thank you. On President's Day, and on top of that, we had our first staff meeting for the nose vlog, so I was already like, you know, wigging out. I'm like, I gotta get organized, I gotta do all my things. But you know, we still made it work, and the best thing about that was one, shouts to Frank and Ashley Jones. Frank Just and Ashley Jones. I know I pronounced Frank's last name wrong. I'm sorry, bro. But they jumped in last minute, like on Sunday or Saturday, I believe. They were like, yeah, we're totally down. I made a little Facebook post and everything else. They jumped in, but we still need 2 more, all right? It's for this short film called It's the Uniform, which is like a brilliant piece about intersectional oppression and everything else.
If you do say so yourself.
Just because I wrote it. Because I wrote it. All right, sorry. But we wrote this piece or whatever, and they did an amazing job. But on top of that, when we were on our way there, after the staff meeting, I was like, I reached out. I was like, yo, Jalen, come through. And I looked at Elliot. I was like, Elliot, come through. I was like, Honda, come through. And, and I was thinking to myself, because we needed. All right,
Long story short, I was tricked into being a yuppie asshole. A privileged yuppie asshole.
I was like, we need 2 actors. Could you handle? And like, I did like, as soon as he said yes, he was like, I think it was we were looking at the email,
Yeah,
and I was like, you're
Let
like,
me email it to you.
Yeah. And I was like, I don't know if you guys can see it, but it was more like there's a leg shake that happens. Like, oh, you can't see the leg shake. There's a leg shake that happens. I'll do it later. I'll do the happy dance.
Flash dance.
I'll do exactly what it was. But yeah, it was great, man. And on top of that, you go ahead, because remember it was also it wasn't just a short film. It was also the webisode.
Oh god, it was like a meta webisode thing. Okay, well, but I mean, just in any case, just to wrap it up, because we do have to get going.
Yeah, we gotta go.
It was a great time. I had a lot of fun. Paul will provide the links to everything to check out. Yeah, it was a great time. Antonio, thank you very, very much for coming and for being and enlightening us and really sharing some perspective from outside the world. If you guys have any other questions, their social media will be available. This has been Rebels in Parks with Coffee.
Wait, one thing.
Notice board.
Tell the man lovers out there, ladies and men, if they are available. It was like, ladies, okay. What? Tell the fans of you guys are available. So okay. Tell them if you're available. tell them if you guys are single. In this case, yeah.
Oh, they're single.
I'm proud of it.
And they'll be residing in beautiful Boston for the
Yes.
next 2 months. So,
So,
ladies,
if
if you
yeah, if you want to like reach out, you know, just reach out. Hit me on the
who
DM.
are you? You're like he's like drunk Cupid.
They show now.
Wait, that's actually all right. We won't mention that, but I definitely did play
gotta
matchmaker.
go.
Yeah, we gotta go. We gotta go. It's cold
You
as
gotta
fuck.
go.
We're
This
hungry
is
as
the
fuck.
Notice blog.
Always question.
Always question. Always explore. Thank you very much.
Thank you guys. Woo.